Good day, learners! Welcome to another exciting and meaningful video lesson in Grade 9 Science. I am Teacher Edwin M. Juanco II, and I will be your science teacher for today's lesson. Before we start, let me be clear with the objective of our lesson. At the end of this video lesson, you will be able to infer how one's lifestyle can affect the functioning of the respiratory and circulatory system. Let me start our lesson by showing you a short experiment. You can try this experiment at home, but make sure your parents will assist you in doing it. Experiment time! The experiment is a simple setup that shows how smoking can damage your lungs. But do you know that aside from your lungs, smoking can also affect your heart? Smoking is just one of many unhealthy practices that could negatively affect the functioning of the respiratory and circulatory system. Later on, you will be able to identify what are these practices and what are the diseases you may acquire if you continue doing it. The bigger question now is, how can you maintain the healthy functioning of the respiratory and circulatory system? To answer that, let's play a short game first called Pick to Word.
Let's play Pick to Word!
The rules in playing this game are simple. First, identify the missing term by studying the given set of pictures. Second, use the three keywords to identify the missing term. And last, you will be given 10 seconds to answer. Are you ready? If you're ready, let's begin.
Picture word number 1. Keywords. Tumor. Disease. Respiratory. Your timer starts now. Hands up. The correct answer is lung cancer. Good. Picture word number 2. Keywords. Blood pressure. Disease. Circulatory. Your timer starts now. Hands up. The correct answer is hypertension. Very good. Picture word number 3. Keywords. Blocked artery, Disease, circulatory. Your timer starts now. Hands up. The correct answer is heart attack. Excellent. Picture word number 4. Keywords. Coughing with blood, disease, respiratory. Your timer starts now. Hands up. The correct answer is tuberculosis. Amazing. Picture word number 5. Keywords. Damaged air sacs, disease, respiratory. Your timer starts now. Hands up. The correct answer is emphysema. Superb.
In picture word activity, you encountered unfamiliar terms such as lung cancer, hypertension, heart attack, tuberculosis, and emphysema. Do you know what these terms are? Very good. These are the common respiratory and circulatory system diseases. To have a clearer understanding about these diseases, let us move to our discussion.
According to the World Health Organization or WHO, circulatory diseases are the leading cause of death in the world, while respiratory diseases are responsible for every 5 deaths each year. Let us discuss first what are the common respiratory diseases. Number 1 is lung cancer. It is also known as lung carcinoma, in which a malignant tumor is developed inside the lungs. The symptoms include coughing with blood, weight loss, chest pain, and shortness of breath. And did you know that 80 to 90% died from this disease are caused by tobacco smoking? Only 10% died from air pollution and secondhand smoke. In this image, you can notice a great difference between the lungs of a non-smoker and the lungs of a smoker. Number 2 is a condition called chronic bronchitis. It is characterized by the infection or inflammation of the bronchi or bronchioles. It usually lasts for 2 to 3 months. That is why it is considered as chronic or long-term infection. Symptoms include shortness of breath and excessive phlegm production due to infection. In this picture, you will notice that the airway lining swells up, causing the airway muscles to tighten. And because of infection, mucus builds up and blocks the airway, making it difficult to breathe. Number 3, tuberculosis. It is a disease caused by a bacteria called Mycobacterium tuberculosis. The symptoms include long-term cough with blood, shortness of breath, and noticeable weight loss. You might ask how smoking can cause tuberculosis. Smoking weakens the immune system of your lungs. And if the immune system is weak, you get easily infected by the bacteria that can cause tuberculosis. The image you can see is an X-ray image of a patient with tuberculosis. You can notice red spots indicating that there is bleeding inside the lungs. Number 4 is emphysema. In this condition, the linings of the air sacs or alveoli rupture that produce larger space. As a result, Damaged air sacs or alveoli trap older oxygen, making it difficult to breathe. And the leading cause of this disease is smoking. This is what normal alveoli look like, while this is when the linings rupture, producing larger space that affect the normal rate of gas exchange. Number 5. Coronavirus disease or COVID-19. COVID-19 is a disease caused by a new type of coronavirus called SARS-CoV-2 that can trigger respiratory tract infection. It spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. The symptoms of coronavirus disease include fever, dry cough, shortness of breath, sore throat, and headache. Protect yourself and others by washing your hands and using alcohol and protective equipment like masks and face shield. You should also practice respiratory etiquette by coughing into a flex elbow like this one. The next topic that we are going to discuss are the common circulatory diseases. Number 1 is hypertension. It is commonly known as high blood pressure that can lead to severe heart complications and increase the risk of many heart problems. And the leading causes of this disease are smoking, obesity, and too much alcohol consumption. Hypertension, if not managed properly, may lead to stroke, vision loss, heart failure, and heart attack. Number 2, atherosclerosis. In this condition, a plaque builds up inside the arteries. This plaque hardens and narrows the arteries that limits the flow of oxygenated blood. This buildup of plaque causes many heart diseases. This is what a normal blood vessel looks like. You can see that blood can flow freely. And this is when a plaque or atheromas builds up, restricting the flow of blood. Number 3 is a condition called myocardial infarction. It is commonly known as heart attack that happens when a clot in the coronary artery blocks the supply of oxygenated blood to the heart. In this image, you can notice that the blockage occurred inside the coronary artery of the heart. Heart attack can be fatal if not treated on time. Number 4. Iron deficiency anemia. In this condition, iron in the bone marrow is not sufficient to produce red blood cells. Symptoms include paleness, shortness of breath, rapid pulse, and low blood pressure. Because of iron deficiency in the bone marrow, the amount of red blood cells become insufficient. Red blood cells are responsible in taking oxygen to the different organs of our body. Women in reproductive age are more prone to this disease because of high level of menstruation.
Let's have a short review about the common diseases of the respiratory and circulatory system. The common diseases in the respiratory include lung cancer, chronic bronchitis, tuberculosis, emphysema, and the latest coronavirus disease or COVID-19. While in circulatory system diseases, we talk about hypertension or high blood pressure, atherosclerosis, myocardial infarction or heart attack, and iron deficiency anemia. These are just few of many diseases that you may acquire and can endanger your life if you continue to engage yourself in an unhealthy lifestyle. Now you might ask, what are these unhealthy lifestyles that can negatively affect your respiratory and circulatory system? Let's find out by playing the next game called Anagram.
Game rules. Solve the anagram by arranging the jumbled letters. Use the given picture clue for each round. You will be given 10 seconds to answer. Anagram number 1. Get ready. Your timer starts now. Hands up. The correct answer is tobacco smoking. Nice! Anagram number 2. Get ready. Your timer starts now. Hands up. The correct answer is alcohol drinking. Wonderful! Anagram number 3. Get ready. Your timer starts now. Hands up. The correct answer is unhealthy eating. Amazing! Anagram number 4. Get ready. Your timer starts now. Hands up. The correct answer is inadequate sleep. Excellent! Anagram number 5. Get ready. Your timer starts now. Hands up. The correct answer is physical inactivity. Superb! What is an healthy lifestyle? It is defined as a lifestyle where a person engages in activities that are detrimental to health. Unhealthy lifestyle can lead to the development of many diseases, including respiratory and circulatory diseases. Number 1 is tobacco smoking. 15% of global deaths are attributed to smoking. It increases the risk of developing many heart diseases and stroke. Smoking is the leading cause of lung diseases such as emphysema, chronic bronchitis, and can trigger asthmatic attack. And did you know that smokers are 12 to 13 times more likely to die than non-smokers? Number 2. Alcohol drinking. Drinking excessively or consistently over time hurts the health of your heart. The more alcohol you consume, the higher your risk for increased blood pressure and stroke. Number 3. Unhealthy eating. Eating unhealthy foods can increase the risk of heart disease and stroke. Avoid foods that are high in sodium and fat. Include whole grains, lean meats, nuts, fruits, and vegetables in your diet to maintain a healthy heart. Number 4. Inadequate sleep. Inadequate sleep can increase the risk of circulatory diseases, high blood pressure, diabetes, and obesity. Healthy adults need between 7 to 9 hours of sleep per night to function at their best and maintain a healthy body. And number 5 is physical inactivity. No exercise practice can cause overweight and obesity that increase the risk of many heart problems. Engage yourself in regular exercise to maintain the health of your heart and your lungs.
After learning about the unhealthy lifestyle that can lead in acquiring diseases in the respiratory and circulatory system, I think it's time for you to decide now. Are you going to continue your unhealthy lifestyle? Or it is time for you to plan and make a list of things you will do to maintain the healthy functioning of your respiratory and circulatory system. Very good. You made the right choice. You might ask now, how are you going to start your plan to have a healthy lifestyle? Let me give you a list of healthy lifestyle that will absolutely maintain the normal functioning of your respiratory and circulatory system.
What is healthy lifestyle? It is a way of living that lowers the risk of being seriously ill or dying early. Not all diseases are preventable, but a large proportion of deaths, particularly those from coronary heart disease and lung cancer, can be avoided. Number 1 healthy lifestyle is avoiding vices. Avoid smoking and alcohol drinking to ensure a healthy respiratory and circulatory system. Number 2, regular exercise. Engage yourself in daily aerobic exercises such as brisk walking, running, swimming, and cycling. It can maintain the health of your heart and your lungs. Number 3, healthy lifestyle is having a balanced diet. Eat fruits, vegetables, whole grains, and fat-free or low-fat milk products. A balanced diet includes lean meats, poultry, fish, beans, eggs, and nuts. And you should avoid overconsumption of foods high in cholesterol, salt, and added sugars. Number 4 is adequate rest. Rest and have a quality sleep to keep your mind and body healthy. For adults, it is recommended to have 7 to 9 hours of sleep every night. And last and the most important healthy lifestyle during this time is proper hygiene. Regularly take a bath, brush your teeth, wash your hands with soap, and use body sanitizers if necessary. Because a good personal hygiene prevents you from getting sick, especially in this time of pandemic.
Let's review the topics we discussed. First are the common diseases of the respiratory and circulatory system. Second are the unhealthy lifestyle that may lead in acquiring diseases in the respiratory and circulatory system. And last are the healthy lifestyle that will maintain the normal functioning of the respiratory and circulatory system. Now that we already finished our discussion, let's see if you learned something.
Part 1. Directions. Determine the disease that is being described in each statement. You have 10 seconds to answer. Number 1. It is commonly known as heart attack, in which a clot in the coronary artery blocks the supply of oxygenated blood to the heart. Your timer starts now. Hands up. The correct answer is myocardial infarction. Number 2. A disease caused primarily by smoking, in which the linings of the alveoli rupture, making a larger space that makes breathing difficult. Your timer starts now. Hands up. The correct answer is emphysema. Number 3. It is also known as lung carcinoma, in which a malignant tumor is developed inside the lungs. Your timer starts now. Hands up. The correct answer is lung cancer. Number 4. A respiratory disease characterized by the infection or inflammation of the bronchioles or bronchi that lasts for 2 to 3 months. Your timer starts now. Hands up. The correct answer is chronic bronchitis. Number 5. A respiratory disease caused by a new strain of virus called SARS-CoV-2 that spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Your timer starts now. Hands up. The correct answer is coronavirus disease. Part 2. Directions. Identify what healthy or unhealthy practice is being described in the given statements. You have 10 seconds to answer. Number 1. Nicole is a health-conscious teenager who runs for about 2 kilometers every 6 o'clock in the morning. Your timer starts now. Hands up. The correct answer is regular exercise. Number 2. It is a habit for Jerome to sleep as late as 2 o'clock in the morning every time he plays Mobile Legends. Your timer starts now. Hands up. The correct answer is inadequate sleep. Number 3. Shane is a high school student who always eats junk foods and drinks soda during break time in school. Your timer starts now. Hands up. The correct answer is unhealthy eating. Number 4. It is a daily practice for Eloisa to wash her hands with clean water and soap before eating or touching her face and nose. Your timer starts now. Hands up. The correct answer is proper hygiene. Number 5. Sean is an athlete who always takes care of his heart by eating fruits and vegetables and monitoring his daily intake of calories. Your timer starts now. Hands up. The correct answer is balanced diet.
Thank you for your time, learners. I hope you learned something from our discussion and you're going to apply it in your own lives. Stay healthy, live safe, and live longer. Once again, I'm Teacher Edwin M. 1 2, your friendly science teacher, leaving you an important moral lesson that you should remember for the rest of your life. It is not pieces of gold that makes a person wealthy. It is our mind, body, and soul that stays healthy. Thank you for watching.